Hi there. We love doing live webinars where we can share best practices and topics of interest to you. To learn more and to access the resources referenced in this video, please scroll down to the video description. Without further ado, I'll turn you over to the team.
Well, hello and good afternoon to everybody in Kentucky today. It was kind of interesting. We decided we want to do a lunch and learn, and if we're doing somewhere on the East Coast, we usually do it at noon, and if we're doing it in the Midwest, we do it at noon, and that kind of thing. But one of the interesting and somewhat challenging things about Kentucky is that we have some Eastern time and some Central time people. So we decided we would do it at 12:30 Eastern and 11:30 Central, and hope that would make it so that people can join us. So we're really excited about today's webinar because we have some agency owners who are going through some of the challenges, not just with COVID and everything in 2020 that everybody's going through, but also really planning for EVV and the reopening of adult day health and all that kind of thing. So I think this is a really timely and exciting webinar. We're so thankful that you are here. And with that, we're going to jump right in. So I want to welcome the community. So if you haven't been to an ANCODA webinar before, it's all about the community. I mean, we are a software vendor. We want to be your software vendor. So I don't want to hide that. But having said that, I mean, we are always about inviting everybody, and in some other states, when we've been, for example, working through their specific EVV things, people have kindly written to me and say, hey, we have our own software, or that kind of thing. Could we join your webinar because we'd really like to share in what you've learned? And we're really all about kind of a high tide, helping all the boats rise and that kind of thing. I think we're in my humble opinion, being an insider, I think we're in the most important industry in our country, the fastest growing industry in our country, and we provide such a vital service with, and especially as we've learned, during COVID-19, that we are a very isolated type of industry, and that we've really found that the services that we're providing have, kept our clients safe and that type of thing. And so much is here. But anyway, I mean, moving on to the slide and the agenda today, I just want to welcome the community. I have one more slide for that. And then we're going to have some agency owners, and they're going to share their experiences. And then we'll open it up for discussions. And we always like to, hear best practices from the audience or take questions, and to always see if there's any ideas for next webinar. So I sometimes forget to ask for that. But before I do forget, there is a way in the GoToWebinar panel where you could ask questions, and Sarah Moore, who's going to be our moderator for the panel and that kind of thing, will, she'll be monitoring the questions as well. So if any real-time questions come in that we could ask the agency owners, that would be great. And also, if you have a best practice to share or anything, you go ahead and put it in the questions panel, even though if it's not specifically a question. So with that, we'll move on. And again, just to emphasize the whole idea of community is everybody's welcome. We're only here on the ANCODA side to facilitate, and we're also, really just trying to provide resources. This is a tough year in a lot of ways, and one of the ways, of course, is that all the states in the Medicaid programs have to start doing electronic visit verification officially by the beginning of 2021. We have seen that a couple states, I know in particular, official announcements from the state of Georgia and the state of Idaho have said that they're not going to hit January 1st of 2021. We do know some things about what are going on in Kentucky that I have on a later slide. But bottom line is, we're really just trying to provide as much help as we can and resources to everybody, and we'll talk more about that as we go. So I kind of edited this slide a little bit ago. I've been seeing a few things move around in the social media, like the coffee cup on the left there. I saw one that had some less appropriate language, and I had to search around for a nicer one. But yeah, it's really a tough year. So I mean, really, the 2020 Cup has to do with the world and not necessarily Kentucky for sure. But it really has been a tough year. We're headquartered right in Boston, and we had some of the some of the aftermath of the George Floyd situation, and and just, I mean, everything. It is just a really tricky year. And and kind of moving specifically to Kentucky, we are, I would say, we are operating in Ancona. Kind of our idea is we really want to focus on a state and become the best solution for that state. And and we pride ourselves on not just being a generic solution for all 50 states, but Kentucky is a challenging state, and I've just kind of listed a few of the high level things that make it tricky here. So one is, of course, as I mentioned earlier, that we're operating in 2 time zones, and that we have the combination of home care and adult day health care, which, by the way, I mean, I honestly believe that adult day health care is going to be probably one of the most important forms of care delivery. And I think Kentucky is leader in that regard, because if we look at, kind of our aging population demographics and compare that to, the availability of caregivers, we really are going to need a way of providing, care for more individuals with fewer resources. So I think that adult day healthcare is really, really important. And of course, a global pandemic, kind of brings that into question. But I guess, just following this bullet, we do have the situation where some people who come to our day centers and then get home care, we have to manage that $200 a day limit. We also, need to comply with EVV. We don't have the best mobile coverage all throughout the state of Kentucky. Then we have other services that we provide, usually just as, convenience to the consumer, like goods and services, where we're not really making money on it, but we have to do it and we have to track it and bill for it. And we also have case management, which I didn't list here. We have spend downs, and there's the trickiness of, if we have somebody who gets home care, case management, and adult day health, I guess, in our case, they probably wouldn't get both case management and home care from us. But I guess the point is that whatever Medicaid gets first as a claim, that's where they're going to take the spend down out of, and that makes it trickier for our accounting. So it's not like you could really predict, where that spend down is going to come from, and that makes it trickier. Just before, in preparing for the webinar, we were talking with Wendy about reopening adult day health centers, and it was announced 2 weeks ago that they could be reopened, but we didn't get guidance until last week. So I'm sure we'll dig more into that. And something that has been announced is that Kentucky's going to work with something called an EVV aggregator. It's going to be this company called TELUS. On the Ancona side, we're very familiar with them, but that is kind of a tricky thing, and it's going to change the way that we submit our claims and bills. So there's really a lot going on, and I'm really excited to have our panel of experts, here in a position to, to kind of talk to us about them. So with that, we'll go ahead and we'll introduce our agency owners. We have Wendy Wempner, who is with McLeod, and we have Cleveland, but we call him CR Gash, and he's from, oh my gosh, I always get this wrong. So it's Interactive Assessment Services of the Bluegrass? No. Okay.
I like that, though.
Okay.
Independent Assistance Services.
Independent Assistance Services of the Bluegrass. And we also, we're expecting Jerry Ferguson, and we don't see him on the line right now, so we will proceed. And without further ado, what I'm going to do is turn things over to Sarah Moore to moderate, and then I'll see if we can track down Jerry and get him in here. But with that, Sarah, it's all yours.
All right, thank you so much, Ken. So I'm going to give a little bit more background about Wendy and CR. So Wendy Wepner is a corporate business office manager for McLeod. They have multiple adult day health centers in Kentucky, along with providing case management and attendant care services in various locations under the Medicaid Home and Community-Based Service Waiver Program. Their mission is to strive to enhance the quality of life of its participants with physical and or mental health concerns by providing quality, individualized care in a home-like setting. Wendy is passionate about training and development of her team, and on a personal note, she loves the outdoors and is a grandmother of 10 beautiful grandbabies, which is amazing. So welcome, Wendy. Thank you for being here. And please feel free to add anything else before we jump into any questions.
I'm good.
Okay. All right. So then I'm going to go ahead and introduce CR. So CR is the owner of Independent Assistance with Kentucky. He's a Kentucky healthcare trainer and contributor to the Avast Therapeutics. He has a background in behavioral neuroscience as well as biotechnology research and development. CR and his father, Don Gash, started Independent Assistance in 2012 after more than 20 years of taking care of family members in home. CR is passionate about health, wellness, and the quality of life issues. Thank you, CR, for being here too.
Glad to be here.
All right, so the first question I was going to jump out and talk about is, in your opinion, what is the biggest Kentucky challenge? We can start with Wendy.
I think one of our biggest one is the amount of time we get for any information that comes from, Medicaid and home community-based waiver services. We're always reactionary instead of, being proactive about things because things change so often and so quickly. And so that's something that unfortunately we can't do anything about, but with trying to get the software system up and things like that, we're trying to just incorporate how better to react with those things when we do get them. What are our tools that we can utilize and really do? But for me, I think that's one of probably the biggest challenge with that, with Kentucky.
Great, thank you. And then CR, I'm going to ask you the same question. What do you, in your opinion, what is the biggest challenge in Kentucky?
Navigating the rules and regulations can be challenging to keep up with. Definitely, they don't make it as easy as you would like to just kind of say, hey, this is how you should, have some guiding principles. But I think that on a daily level, some of our biggest challenges will be hiring and employment with running our business. It's tough to keep track of our employees, where and what they're doing. Are they documenting correctly, or even just having enough employees to service the overwhelming need that I see out there. I think that we don't have a problem really finding clients. We have a problem stabilizing our schedule on a day-to-day basis.
Perfect. Thank you for that. And then, so since you have the mic, CR, we'll keep that with you. Then with those challenges, what is the best solution that your team has found for meeting some of those challenges?
I was just thinking about this a little bit ago, because we have a young college student who is very in touch with today's marketing and social media. And she has come in, and we have worked really hard with her, developing our strategies to better communicate with our staff and potential staff. And I feel that our communication and discussion with people has evolved because we've put a lot of resources into how we communicate with people and bring them to our agency and then train them. Even our monthly newsletter has had huge impacts with our staff and then having a buy-in with what we're trying to do for the people we serve.
All right, fantastic. Wendy, how about you? With the challenges that you mentioned, you talked about software and how that's helping, but I know with information, not getting that readily, is there any other tool that you've found that has helped your agency?
Really, something that he said too, I didn't even think about the hiring. We do have challenges with that too, but we're coming to find that the communication and how we talk to people and who we're calling, and really kind of getting a list together of who our best resources are, who the best people have been that have helped us, go back to them, stay in communication with them. I know we've had some billing issues, and so our billing coordinator has her go-to people, our case managers have their go-to people, and kind of sharing those lists with everybody else too. We're meeting a lot more. ourselves, whether it can be in person, it can be, in a webinar or just over the phone, to try and handle more compartmentalized different departments, and then taking what we get from there and kind of moving over to, the other departments and stuff. But it's been a bit of a slow process, but we feel like we're kind of starting to get a grasp on it. The things that come from Kentucky Medicaid, they just change so quickly that we can't, you could have somebody just monitor the websites all day long and you probably still wouldn't catch, things. When we do an audit and they come in, we're finding, oh, well, this was put into place. Well, when was that put into place? And we are having a lot more people have to really research. But like I said, the main thing we found is just that communicating it out to everybody has made a world of difference. And I feel like a lot more people in our company are starting to jump on board with trying to resolve those things instead of just kind of like throwing their hands up in the air and being like, well, I don't know what to do. It's more, we call them round tables, having the round table discussions. And even if it's 10 minutes in the morning, we get, people on and okay, well, you go do this, you do this, and you do this, and then we'll meet again this afternoon. And that's kind of one of the biggest things that's helped us a lot over the past probably 6 months.
So that kind of speaks towards a little bit too about how process has been changing with this era of COVID. And we talked a little bit before we did the live broadcast about how, Ken mentioned this too, about how you had very little notification that it was time to reopen the adult day centers. So we'd love to know a little bit more about your process there and what that world looks like, in this with COVID-19.
Well, so the governor announced, I think early last week, that the adult daycare centers could open on the 29th, but we couldn't do anything until we got the rules and regulations on what needed to be done, and that didn't come out till Wednesday. So some of the things were easy because we had already taken the time while we were closed to go in and thoroughly clean, move all the tables and chairs to the social distancing, kind of some of those basic things that we could do, got PPE, and put our processes into place and everything. But the things that came out during the guidelines that they sent out were things like it has to be an infrared thermometer, which is not really easy to come by right now. So we had to get the stickers for the social distancing. We had to get separate bins for each of the participants. And the biggest one that really threw us for a loop was everybody, employee-wise and client-wise, had to be COVID tested and have a negative result before they could come back. So some of the testing places, because we're in 4 different locations, Hart County, Taylor County, Adair County, and Marion County. Well, they have different places that test, and each of them are different time frames for getting the results. So you had a couple that were 15 minutes, but then we still got actually 2 employees in one of the locations that they don't get their test results until day after tomorrow, but we opened the center today. So trying to navigate all that and then get all the participants that were going to be allowed to want to come back into places. They wanted us to provide transport, and with transport, you have to give them 72-hour notice, and then transport has their own guidelines, so they can't have as many people in. And so it's been a huge process for getting all of that done within a very short amount of time. So it did push us back to being able to open Tuesday instead of Monday. And then still today, we're still finding out different things. Our case manager and our nurses are scrambling all over the place to start scheduling and, making calls. And then we've had people that were like too scared to take the COVID test, but really want to come back. And so we're working with doctors on being able to do blood tests instead of the other type of tests. And it's just been a big undertaking, basically.
Yeah,
So Wendy,
absolutely.
this is Ken jumping in. So I actually had the pleasure, because I've gotten old, to have a colonoscopy last week at the Tufts Medical Center here in Boston. And I had to go for a COVID test a couple days before, and they did it with kind of a, sort of a nose swab, like a Q-tip kind of thing. Is that how they're doing it there as well?
Yes, but we have some people that are elderly, and like I have one who she's very afraid because she gets bloody noses really fast, and then they're on blood And then so we're trying to find a way to get her doctor to order a blood test instead of because she's just really afraid that she has a hard time getting nosebleeds to stop in the first place. So, and she really, really wants to come back, but there's very limited ways for them to do the testing right now. And those are really our only two options, is the swab or the blood test. But the blood test has to be doctor ordered, and not most of the doctors are not doing that.
Yeah, that is a challenge. Back to you, Sarah.
No, thank you for that question. I had to have one as well, and they're not pleasant, that's for sure. All right, so back to UCR. We had a question if you could elaborate on some other communication best practices that your employees or that you're employing in addition to the email newsletter.
We did a survey of all our care assistants and allowed them to encourage it to be anonymous, so that they could really give their viewpoints about what they weren't happy with, what they were happy with. It was our first attempt, and our mistake on it was we asked too many questions, but I think that it's that reaching out and trying to get them to really express what they feel that they're missing or not getting. So we did a survey, and we reviewed the results as an office, and you know, it's hard not to take some things personally, but once you took yourself out of that reactionary kind of response, you could actually see what was really affecting them and what we could do as an office to better create growth between the communication of the office with the staff. I mean, the other things that we've done is we've worked with Ancoda to get a texting out. So daily we're asking them to double check with them. Have you had a fever? Have you been exposed to anybody? You know, we're using so many of the different mechanisms out there to be in constant communication with them to better document all this stuff, but also grow as an agency. I think one of the things that has really grown out of it is we've also expanded training for people that were uncomfortable doing things but never expressed, hey, I have trouble with transfers, or I have trouble with bathing because I was shown it like 20 years ago, but is there other ways that I could do this that I would feel more comfortable? So with Ancoda's texting system, we've been able to reach out with them in a better way, and texting is one of the ways that they love to communicate. We were initially against it, but the more we actually embrace some of these things, the better overall morale we get from everybody. So one of the huge challenges has just been everybody having access to documentation, but it all being encrypted and safe for HIPAA standards. So, you know, that has been one of the daily things I've been trying to get, because most of my office is still working at home. So sometimes encryption is great, but it really gets in the way of actually being able to get to your data. So those are a couple of different mechanisms that we use to reach out. I don't know if I necessarily answered the question though.
Yeah, I think you did. So thank you for that. And I guess this is a question to, to both of you. Back with our caregivers and everything is, how about caregiver burnout? Are you seeing caregiver burnout right now? What can be done? And, what do you use to help with that?
Great question. We do. We've always seen caregiver burnout, but with maybe sometimes less staff available for some weeks because they're out waiting on getting a test, so they'll be sidelined for a week or two. Some caregivers have to take more hours. I have one caregiver that did 60 hours a week for the last couple weeks. You know, that's a lot of time. So we try to enforce some days off, and I think that's tough when you have plan of cares to meet, and case managers are going, hey, they're supposed to get 44 hours. You only gave them 38. That's not fair. Well, they're going to get 38, but it's better than losing a caregiver and us only being able to give 5, you know? So I think you have to keep really good tabs on how your staff is doing to know when they need a day off. One of the bonuses we gave, and we're probably going to do another one, was we gave 8 hours off for a full day paid to our staff as a whole. And we're going to do that again so that they feel that they can take a day off and still have money to pay their bills and stuff. And I think that these are ways that you can positively embrace your workforce and have them thankful for working with you, you know?
Yeah, absolutely. Thank you for sharing that. And Wendy, your perspective.
We haven't really had too much problems with burnout yet. I think we've had maybe 2 that were just like, but they were balancing 2 jobs as well. What we've had more issues with is our participants being so scared about all of this that's going on, and then, you know, questioning our caregivers. Who have you been around? What have you been doing? That, you know, just really. And then also on the flip side of that, we have the participants who can't go anywhere, but they're seeing their caregiver come in and out and in and out. And so it becomes a lot of our caregivers have had to learn more of like patience and understanding on a whole other level of what these people are going through because they have no one else, or, you know, things like that. And so I think it's been more, we get phone calls about, well, how do I handle this and how do I handle that? And they want to do this, and can I take them here? And things that are really outside of scope of their plan of care, but they love them so much that they really want to help them, you know, and us still having to keep them within guidelines of what you can do personally and professionally kind of thing. But burnout wise, luckily right now we haven't had too many problems, but we do try and adjust to where if they need a day off during the week, we'll work with the participant to see if maybe they could make it up half a day or something like that on the weekend, or just trying to, because some of them that go 5 days in a row are just like, I need to go take care of some errands. I need to go do something for me type of thing. And so that way the client is still getting their care as much as possible. You know, they may be short 2, 4, or 5 hours or something like that. But like CR said, it's better to have them get some care than no care at all. And most of our participants, as long as we communicate with them and kind of be a part of that discussion, have handled it pretty well. So, but we haven't seen a lot of burnout necessarily, and I'm knocking on wood that we don't. So.
Fantastic. So I guess I should go back for 1 second and say that question was not my question. That came from our audience. So thank you, audience. And I also should note that CR has a very adorable short-haired German pointer. So
I knocked on wood, and my dog thought there was somebody at the door.
Yeah, that's funny. All right. It's a very cute dog, though. And then this other question comes from our audience as well. How will TELUS work for EBV and claims? So we mentioned that earlier in the presentation. So Ken, I don't know if you can speak about that one a little bit.
Sure, happily, yeah. So TELUS is positioned as what's called an EVV aggregator, and we're working with them in Virginia and in Florida. And in those 2 states, the flow is that we no longer send our claims to Medicaid. We actually send, for each completed and approved visit, we send a big, data record to TELUS, and that basically says, all right, well, here is all the basic information. So we know that we have the client with their Medicaid ID and the type of service, so like our T1019 code and the date of service, but we have an actual arrival time and departure time as recorded by electronic visit verification. And in addition to that, we have the way that we are confirming the location. So if it's with voice telephony, we are providing the phone number that the dial was made from. And if it's from GPS, we're providing the GPS information at the time of arrival and time of departure. I see I have my friend Leia here coming into the screens. That's one of my coworkers, Leia. She has a brother named Luke. So anyway, yeah, this work from home, it's fun stuff. So yeah, so basically, I mean, so it's very different. So instead of even submitting a claim, we're sending all of this to TELUS, and then TELUS is first of all making sure that everything matches and they match against the authorization, and then they have a set of rules which we've seen are slightly different between Virginia and Florida, where in the state of Kentucky, it'll be Medicaid telling them, hey, what do you want me to check? And and they'll check, okay, well, A, B, and C. And then as an agency owner, you would go onto this TELUS portal, and it would be like, hey, I just sent 400 visit records up to TELUS, and kind of step one is all 400 went through. So that's something that you'll need to confirm. And the reason, by the way, that it wouldn't get through to them in the first place is if you do add a new client and the Medicaid ID is wrong, or even like the date of birth is wrong, that would be an exception. So we see that now and again, but usually it's a one-time cleanup and everything is good to go. And then you go into your TELUS portal and says, great, you have these 400 visits here, and they use this terminology matched and not matched. So they'll say, okay, you sent us 400 visits, 387 of them are matched. And then of these, other 13, they're not matched. And then it'll basically tell you, based on the rules set by, Medicaid, this didn't meet our criteria because we don't like the phone number, or because we don't like this or that. And and then from there, you go through a process of making the claim match and releasing the claims to in Virginia and Florida to the appropriate MCO, but in the state of Kentucky, it'll be releasing it to Medicaid for payment. So, I mean, that's kind of an overview. We at Ancota have a really good relationship with the TELUS people, and so, we're really good at figuring things out and getting things to flow through to them. I guess one thing I'll point out further, which is important, is that in both Florida and Virginia, where we have the experience, we don't send claims anymore. We only send this visit record over to TELUS, and then when it quote unquote matches, then they send it straight through to the payer, right? And they're the ones who are they're taking the data, putting it into the 837 claim and sending it through to the payer and that type of thing. It's conceivable that like, for example, in the state of Missouri, our understanding is that we're going to continue sending claims to the Medicaid, which they call it EMOMed, the electronic Missouri Medicaid, whereas we're going to also send the visit records with all of the electronic visit verification attribution over to the aggregator. And I guess, so I think that's probably more of an answer than you wanted, but just kind of going through the criteria of electronic visit verification at the national level as defined in the 21st Century Cures Act, I think I covered all the points. I mean, the big one, the hard one, is location and exact times and what was the method of visit verification. So was it with mobile GPS, or was it with telephony, or was it with a fob, that kind of thing. But another thing that you do need to provide to the state is the caregiver. So you'll be providing caregiver attribution as well. So that's kind of something that we have to look forward to. Again, we've heard the announcement that Kentucky's going to work with TELUS, but we haven't heard more detail than that. So thanks.
Thank you. I appreciate that. Well, I think that's all the questions I have, but Wendy or CR, is there anything else that you'd like to add?
I just wanted to say, like, having the experience with Ancota, you know, even though we've had like mostly location challenges and stuff, one of the questions that you had mentioned is maybe like what difficulty are we having with billing? And honestly, the billing process has been pretty smooth. Really, it's the having us stay on top of the reviewing, having our employees actually try clock in, all that kind of stuff that has really caused the delay on, you know, being able to bill and then do payroll in a timely manner. So, the texting, we had forgotten about the texting, and I remember that last week. It made our life so much easier. So, because everybody will look at a text, we've been emailing like crazy, and you know, nobody was responding to anything. But that texting, even for the EVV, as soon as they get on there, it tells them they have a message and everything. So those have really helped get our billing process through a little bit more quickly and more thoroughly, I guess. So I think we found quite a few less issues this past week with a lot of their clock-in stuff. So there's a light at the end of the tunnel, but they're all really kind of liking that it's electronic instead of like paper and everything. So I know it's going to be a time, you know, everybody just allowing for time to get through these, and then having the GPS issue stuff, but we're really working on the EBV the telephony and the fob situation, and the fobs have actually been a lot more beneficial than what we thought. So I feel like by 2021 we'll be in a good place.
That's fantastic. Thank you for sharing that, and for the billing piece as well, because I know that was, you know, it's always this kind of a scary process, but I think your team handled it so well, and you guys turned that switch really quickly. So good work with your team. And CR, anything else you'd like to share?
One of the things we recently finished was we updated all the plan of cares and our tasks inside of Ancota, and our care assistants are really getting used to embracing the digital filling out of their ADL forms, and we've really moved forward with the digital pictures for uploading receipts and training our staff about some processes to make sure that the client has signed the receipt in the picture, so we get that extra layer, you know. So moving in this has actually made our daily review of client services so much easier, but dedicating one person every morning for the first hour of what they do of reviewing all the prior stuff has really aided us to keep on top of how our clients are doing, how our documentation is doing, and all that. So I think that moving digital is really strengthened much of our services and the way we're able to help people.
Awesome. Thank you for sharing that too. All right, I'll turn it back over to you, Ken.
Well, thank you. So, I mean, I think that was fantastic. So let me just, again, thank Wendy and CR so much. I mean, I think that was great. And we'll be, you know, the audience is very appreciative, and we'll also be sharing this more broadly, and we'll make the webinar available to other people. Just kind of going over to the screen, you know, we at Ancota, we're happy to help. And, you know, again, we'd love to be your software vendor. But if we could help with anything else, you know, when the time comes and you need more help with TELUS, let us know. Or if you need, you know, any best practice sharing or resources, just reach out to us. And you could always, you know, even if you're not a customer, just email support@ancota.com or give us a call. And if we could help you, that would be great. And then also, you know, Sarah and Jeremy Hamill, who's our head of customer success, have put a new initiative in place that, and they've created a website called ahomecarecommunity.com. And on that site, they share events like this event. And if we hear of other industry events or webinars and that type of thing, it's there. And there's also like a chat forum, and we're kind of building up our audiences state by state, because that's kind of the nature of Medicaid. So, so that's another resource for you. If we could help you anyway, let us know. But with that, I will turn it over, and I'll one more time give a big thank you to our panelists and to our moderator, the lovely and talented Sarah Moore. And I think we're going to call it a day on this webinar. And thank you again one more time.
Thanks for watching this video from ANCODA. For further information, scroll down and click on the link in the video description below. Have a great day.